things that happened during the Affordable Care Act, and as hard as it is to imagine, there are people today that still want to get rid of it, that actually this week talked about getting rid of the Affordable Care Act again. And you can imagine the devastating impact it would have on so many different people. So what are some of the things that have happened because of the Affordable Care Act? Before the Affordable Care Act existed, health insurance companies could say to people, you know what, you're very sick, you have a lot of problems like diabetes, for example, or other pre-existing conditions, things that you have that you're ill from already, and therefore we're not going to give you insurance. You're too much of a risk, it would cost us too much money, you have a pre-existing condition, we're not going to let you even buy health insurance from us. So that used to be the law in America, that you could deny, and health insurance companies could deny people insurance because they had pre-existing conditions. And based on just purely financial decisions, insurance companies would deny people that access. Now, under the Affordable Care Act, you can't discriminate against someone because of their pre-existing condition. So the people that want to get rid of the Affordable Care Act want to get rid of that law that says you can't discriminate against people who have a pre-existing condition. And I'm going to ask the Castronovas to tell us their story. People have more access to life-saving preventative care. Americans are protected from annual and lifetime limits for coverage. It used to be in the old days, insurance companies could say, oh yeah, we'll give you insurance, but if you exceed this amount of money per year, or if you exceed this amount of money during your lifetime, so imagine somebody's got a chronic condition who has to go to the hospital over and over again, or has to get operations, or has to have some sort of serious care, the insurance company says, oh, we'll cover it up to $200,000 or $100,000 or some number, and they would cap it, and then you'd have to cover everything after that. Now, think of people who really need their insurance because of some reoccurring condition or some chronic condition. In the old days, they'd say, after this amount, you're on your own. And that's just would have been devastating. It was devastating for so many families in our country. You can't do that anymore. You can't do caps on annual and lifetime coverage anymore. Today, we take it for granted, big thing in our family, I'm sure a big thing in a lot of people's families, your children can stay on your health insurance until they're 26 years old. Because one of the biggest uninsured populations in the country historically were young people. Because, you know, young people say, hey, nothing's going to happen to me, everything's fine, I'm okay, don't worry about it. And think of the emergency room. I know you used to be the boss of the emergency room. You know, people would come in, a lot of young people would come in, you know, doing crazy things as we all did when we were young, and you're probably going to keep on doing for a couple of years. So. But now everybody's covered by their parents' insurance up until they're 26 years old. And Americans are also protected from rescissions, discontinuing coverage with retroactive effects, which, you know, just imagine if they said, oh, you know, we gave you this coverage and but we didn't mean to pay for this. We're going to go back and you're going to have to pay back money retroactively. So listen, the Affordable Care Act is not perfect. And health insurance and medical care generally, health care costs are very, very expensive. And we have to constantly figure out, especially in this time when people are so concerned about the cost of living, how can we reduce the cost to people related to their health care? Prescription drugs is one very big area. We had a big success when I was last in Congress back in 2022 or 2021 or so, where we said that the United States government can negotiate prescription drug costs, because the biggest purchaser of prescription drugs in America is the United States government through Medicare and Medicaid. So we have this huge amount of drugs that we pay for. So we negotiated a law back in 2021 or 2022, I can't remember now, that said we can use our purchasing volume and go to pharmaceutical companies and say, we want you to give us a volume discount based upon the fact we purchase so much of your drugs. Because in fact, in America, you can have the exact same drugs as you do in other countries, and our drugs are much, much more expensive than every other country of the world. And there are a lot of reasons related to that. Some of it related to the fact of the laws that we have. Some of it related to the fact that we're the only country in the world other than New Zealand that allows drug companies to advertise on television. Can you imagine all the advertisements you see on television all the time? We're the only country in the world other than New Zealand. And there's like, 160 or 180 countries in the world. We're the only one that lets you put those TV commercials on. And those TV commercials are on, all the time, especially if you watch the news. And there are other things related to marketing of drugs that we allow in our country that you can't do in other countries. So we want to be able to negotiate the cost of drugs. And we want to cap insulin, the cost of insulin. That's a very, very big thing that we do for some people in America now. We've made it much cheaper for some people. We want to make it cheaper for everybody because there's a whole history related to insulin. I'm not going to